Hi, I am Ricky Chuchetuis Obadong, and today I am going to discuss about inverted and impacted maxillary third molar removal by lateral transposition method. Background. Third molars are one of the most commonly impacted teeth in the oral cavity, but in very rare cases, the impacted molars can be inverted as well. In this case, the patient presented with an inverted and impacted left maxillary third molar. The aim of the operating surgeon was to execute the procedure in the least hazardous manner to avoid any surgical complications. Methods. The surgical extraction of the tooth by lateral transposition method was carried out rather than the classical method owing to the inverted position of the impacted tooth. The surgery was carried out under the local anesthesia. An incision was made at the crest of the ridge with an anterior releasing incision. Bone overlying the impacted molar was removed, following which the tooth was luxated and laterally transposed. The socket was thoroughly irrigated and closure was done by simple interrupted suture using 3-0 Mersilk. Results. The impacted and inverted maxillary third molar was successfully removed by lateral transposition method without any complications. Conclusion. The impacted and inverted maxillary third molars are not commonly encountered in dental practice. Subsequently, their removal can be a challenging job on the part of an oral surgeon. The surgeon should preoperatively weigh carefully the associated risk factors and explain them thoroughly to the patient. Introduction. An impacted tooth is one which fails to erupt in the dental arch within the expected time. In other words, a tooth is said to be impacted when its path of eruption into the occlusal plane is obstructed by the presence of another tooth, bone tissue, so that further eruption is unlikely. An impacted tooth can be erupted, partially erupted, or unerupted and will not eventually assume a normal arch relationship with other teeth and tissues. The etiology of impacted teeth can be divided into local and systemic causes. Local causes include irregularity in position and presence of adjacent teeth, dense overlying bone and mucosa, underdeveloped jaw or large tooth size, and premature loss of prolonged retention of primary teeth. As a general rule, all impacted teeth should be removed unless removal is contraindicated, as advancing age makes the removal of these teeth more complicated. The indications of removal of impacted teeth are perichorontitis, dental caries, facilitation of orthodontic treatment, periodontal disease, obscure facial pain, root resorption, and odontogenic cysts and tumor, and pain of unexplained origin. So we have here our case report. A 58-year-old patient reported to the Department of Oral and Maxillofacial Surgery complaining of obscure pain in the left maxillary posterior region that radiated to the left parietal and temporal regions of the head. The patient visited a local dentist 7 to 8 months back who proposed the cause of pain to be carious left maxillary first and second molars and thus advised their extraction, following which there was temporary relief of pain. Then we have here the intraoral periapical radiograph showing an inverted and impacted left maxillary third molar. So, clinical management. The patient was informed regarding the presence of this impacted tooth and was advised the surgical removal of the tooth. So, the picture indicates inverted and impacted maxillary third molar. The absence of first and second molar is depicted as was in our patient. The surgery was carried out under local anesthesia. An incision was made at the crest of the ridge with an anterior releasing incision. So the picture indicates incision given in the maxillary third molar region for the extraction of inverted and impacted maxillary third molar. Then the lateral cortical plate of the maxillary bone overlying the impacted molar was removed by the postage stamp method with the rose head number 8 burr. So the photo indicates trapezoidal flap, raised and postage stamp method of bone cutting. Then we have here bony window made in the buccal cortex to expose the inverted and impacted maxillary third molar. Then the tooth was luxated and laterally transposed. So lateral transposition of the tooth was done as first the tooth was inverted and to expose the crown till the CE junction. Example, beyond the greatest reed would involve lot of bone cutting. Thus, to preserve the osseous tissue, lateral transposition was necessary. And second, to prevent slippage of the tooth into the maxillary sinus following application of force using an elevator of forceps, lateral transposition was done. Then lastly, we have a picture here that indicates the closure done by interrupted sutures. We are using interrupted sutures. So the removal of maxillary impacted teeth requires a thorough clinical and radiographic examination of the patient. After deciding that the removal of an impacted maxillary third molar is indicated, a thorough assessment of the difficulties which would be encountered and the possible complications which might occur during the removal of the tooth are evaluated. So we have here classes about maxillary third molars can be classified based on anatomic position, such as first we have class A with the lowest portion of the crown of impacted maxillary third molar is in line with the occlusal plane of maxillary second molar. Then class B, we have lowest portion of the crown of impacted maxillary third molar is between occlusal plane of maxillary second molar. Then class C, lowest portion of the crown of impacted maxillary third molar is at or above the cervical line of the maxillary second molar. So there are various angulations of the impacted maxillary third molar. The position of the long axis of the impacted maxillary third molar with respect to the long axis of the maxillary second molar. We have here the first one, which is mesioangular, the second one distoangular, the third one is vertical, the fourth one is horizontal, the fifth one is buccoversion, the sixth one is lingoversion, and lastly, the seventh one is inverted. Relationship of impacted maxillary third molar to maxillary sinus. First, we have sinus approximation, where there is no bone or a thin portion of the bone between the impacted maxillary third molar and maxillary sinus is known as maxillary sinus approximation. Then, second one, no sinus approximation. There is 2 millimeters or more of bone between the impacted maxillary third molar and maxillary sinus. Then we have here our conclusion. So our conclusion is the removal of impacted and inverted maxillary third molars can be a challenging job on the part of an oral surgeon, as such teeth are not commonly encountered in dental practice. The surgeon should preoperatively weigh carefully the risk factors associated with the surgical removal of inverted and impacted maxillary third molars and explain them thoroughly to the patient. That would be all. Thank you.